Welcome back. OCD, or Obsessive Compulsive Disorder, if left untreated, can have negative effects over one's lifetime.
Our next guest has been researching this topic for 25 years to help young people get the treatment they need early and heal from this troubling disorder. Dr. Marty Franklin is a co-author of this book. It is called Treating OCD in Children and Adolescents, a Cognitive Behavioral Approach. And we are happy to welcome Dr. Franklin to the Morning Blend this morning. It's so nice to have you.
Thank you.
Thank you so much.
Nice to be here.
I think the most important thing, and I would think this is precisely what you'd want to say about it too, is that if these things are not treated as kids, especially if it's interfering with a child's daily routine life, ability to function in life, this is a type of problem that could persist for someone's entire life.
No question. And when I started my own work way back 25 years ago, almost every adult patient I saw, when I asked them about the history of their symptoms, they talked about childhood onset, which sort of pushed me to want to treat kids, because if you can do it sooner and get people better sooner, then you save them a lifetime of dysfunction.
Mm-hmm. Let's talk about the symptoms. As parents out there, what should they be looking for?
I'd say the first thing you're looking for are unwanted thoughts that the kid is describing and worries that the kid has. And lots of kids have worries. I want to differentiate it from that. But what you also see in OCD is you see a lot of repetitive behavior. So a kid who might ask you 6, 7, 10 times, are things okay? Am I going to be okay? Or they're asking about, is it okay for me to drink that because I'm not sure that whether somebody else touched it. And you'll hear that from kids, but I think when you start to see it cross over from being a little bit of a quirk or a minor concern to affecting their functioning, that's where we start to get parents to pay attention. Kids who are checking their homework repeatedly, kids who won't hand things in because they're not perfect, those sorts of things get us to pay attention to, is this indeed enough interference to call it OCD? And then if we do call it OCD, what do we do about it? Well, we get parents to be aware of that.
In terms of what we do about it, what I love is that your message is about a specific kind of therapy that's called cognitive behavioral therapy, proven to work.
Yeah, and we've spent the last 20 years, my colleagues at Penn and Brown and Duke, working together on collaborative clinical trials and testing the efficacy of these procedures. So you have a procedure, and that's what the manuals are about, setting out a series of procedures to try to help people with. And then we test them. We've been comparing them to medication. We've been comparing them to other forms of psychotherapy. And after 20 years, and the update comes largely because we have 20 years of science to back us up, is to talk about where the science is, and also how the treatment has evolved over these 20 years as well.
Right. When you said this is the rewrite of the manual.
Right.
But it's the people who wrote the original manual with 25 years more experience.
That's right. That's exactly right.
Okay. And when you say the processes, what have you seen that you think needs to be changed in the way that we were doing it in the past, and what you want to see done now?
Yeah. I think I probably would say I want to get faster to exposure. So exposure, basically, to put it in a straightforward way, is you teach somebody to confront the situations that provoke their anxiety, and you get them to reduce and eliminate compulsions they have associated with it. So if I have somebody, for example, who's afraid of touching things, I would have them touch the desk and then not wipe their hands, not wash their hands. I'd have them tolerate the discomfort. Because after a couple of minutes, customarily, or maybe a little longer, you'll see that the anxiety starts to go down. And then the kid learns something from that. Say, wait a minute, this is not as bad as I thought. And then I can gradually move them up a hierarchy, a ladder, to go from things that were a little bit anxiety-provoking to somewhat to a lot, and get the kid and the parents, of course, to collaborate in teaching this kid to lean into their fear instead of away. That's what we're trying to do.
Well, and it's a traditional thought, the idea of face your fears.
Of course.
But science has now proven that if we face our fears, we can get over them, and we can change our brain. What I love too about CBT is that it's about education. I feel like it's sort of teaching, and in this case, children, adolescents, to understand the relationship between their thoughts and their behaviors, perhaps that are compulsive, but also their emotions and their feelings as it relates to those things,
100%.
right?
And I think that teaching kids and teens what you control and what you don't control is really important. If you're trying to control your thoughts and not have certain thoughts, guess what you're going to have? More of the ones you don't want.
Exactly.
And so you wind up trying to teach the kids, don't try to control the thought, try to change your response to it. And sometimes the changing of the response is, instead of trying to make it go away, sit with it, let it be there, recognize that this is just my OCD talking, and I'm not going to give in.
Because while it might be uncomfortable, it's not necessarily dangerous.
Right.
So yeah, I love
Thank
that you're
you
helping
so
people
much.
do this. It's wonderful that people can meet you and find out more about this incredible book. Thank you so much for your research and all the work that you've done to help kids and adolescents. The book is called Treating OCD in Children and Adolescents, a Cognitive Behavioral Approach. You can meet the author tonight at 7 p.m. at Boswell Book Company. It's located on Downer, and find out more, get a copy of the book, ask you questions, and all that good stuff too. Thank you so much, Dr. Franklin.
Thank
we
you.
appreciate your time.